going to say some background for people that are unfamiliar with maybe who you are and what you do.
Yeah. Okay, great. So first of all, thank you so much for putting this together. I think it's brilliant to use your platform and give your team and all of the people who are interested and involved in the crypto Twitter sphere a space to engage politically and really share what their what their opinions are, and to also give candidates like me who are progressive and excited about making change a place to speak to folks that I'd otherwise not get a chance to other grab your hand somewhere. So this is really a great idea, and I think it's wonderful that you're doing it, and I'm really happy to be here.
Yeah.
um, so just a little bit of background about me. So I'm in central Wisconsin, which is the middle of the state, in a place called Wausau. We've got, I don't know, about 100,000 people here. It's a small town surrounded by um, fields and a lot of ginseng here. We have a large Hmong community, but are relatively homogeneous kind of community, and a pretty conservative one, I guess, is my point. Um, and so my family has been here since 2005, and I've got 6 kids. My husband's a urologist, and I'm a breast imager, which means I'm a radiologist that specializes in breast cancer detection. And I've also dedicated about half of the last decade to global health, meaning that I've worked with the World Health Organization and the Pan American Health Organization to build healthcare access systems and infrastructure and educational systems, sitting at the table with ministers of health and CEOs of nonprofit organizations and universities and all sorts of different people to bring together folks from different nationalities and different backgrounds to accomplish goals. And it's really become very clear to me that a lot of people in our country, for good reason, have lost faith in the current system and in our current politicians and the way they practice politics, wondering sort of where their allegiances are and what we need to do in America to get proper representation of our country, which is changing a lot and has changed a lot during my lifetime. I'm 51 years old, by the way, so I'm a little more mature, I like to say, or wise, or whatever, than a lot of the people, actually, than everyone in my field right now here in this race. And I jumped in this race to shake things up, to win it. I want to win it, but to shake things up, to get people really start thinking about what we can do differently, and that this is our country and our government, and we deserve to have the representation and the progress that is demanded at this point in history. So that's why I'm here. And I can share whatever. We can take it from there. I'll let you take it from there.
All right, awesome. So yeah, let's start off for people that are maybe unfamiliar with the political system. So, what is the role that you are running for, and how it fits in to the political system and in your area, and then also what would your responsibilities be?
Okay, so I'm running for federal Senate. There's a state legislature that is elected by different sections within our state. And then there is the House of Representatives in Washington, D.C., and there is the Senate in Washington, D.C. The House of Representatives has over 400 members, and those are based on the number of people in their district within their state. And so people like AOC and Ilhan Omar, and let me think of some, and Roe, I can't think of his full name right now, but he's a California guy. Nancy Pelosi, those are all people from the House of Representatives. And so the way the government works is that bills are generally initiated in the House of Representatives, and then they move on to the Senate. And the Senate is responsible for approving legislature and also for selecting the nominees for cabinet for the president. So the position I'm running for is one that is one of 100 seats in the federal Senate, and my responsibility would be to represent the needs of the people of Wisconsin and make sure that those needs are understood and fought for at a federal level, but also to represent and fight for the needs that we have as a nation. So, for example, Medicare for all, federal voter protections, um, immigration reform, climate change solutions, more national solutions. So, this is one of the most powerful positions in the country, certainly, and perhaps even more broadly than that, is a very globally powerful position.
Awesome. So then, what about you and your experience qualifies for you to be in the Senate or to hold political office? And then maybe what are some of your strengths? And then, if you could be so humble, what are maybe some of your weaknesses?
Okay, those are great questions, and I'm excited to share with you. So, I think the things that qualify me to be a representative at such a high level and for our entire populations are basic human traits that we should all prioritize and value, such as honesty, integrity, accountability, um, empathy, compassion, wisdom, good judgment, all of these sorts of things that we would like to see, I believe, in every human being that holds a leadership role. Um, and a lot of questions recently have been related to the fact that I've never held an elected position before. And I feel that this is, at least at this point in our history, and perhaps at every point in our history, this is a huge advantage. Our country was not designed by the founding fathers to be run by people who dedicate their entire lives to politics. Having a broad set of representatives, people who have been in science, people who have been in law, people who have been educators, who have perhaps served in the military, who have perhaps been judges or nurses or what have you. Those, we need a breadth of representation to bring a proper comprehensive understanding of the needs of our people. There are other really important, loud, change making voices in Washington that are similar to me, have not held prior elected positions. And one of them is Elizabeth Warren, who, similar to me, acted um, as a consultant in her area of expertise, which has been my role in global health for the past 10 years. And another person, of course, is AOC, who is a change maker and a thinker, and someone who is fearlessly and boldly fighting for the rights of the people that she represents. So those are, I think, some of the advantages of my position and my relative newness to to politics. I think another advantage is that I have not lost sight of my goal. I really do feel like many of the politicians today are more worried about the next election than they are about getting what they've promised to get done. And that will not be me. It's never been me. I love doing the right thing because it's the right thing. And for that reason alone, and that's what I do as a physician and as a mom and as a citizen, and that's what I will continue to do in Washington. And if that's not enough to keep me in my position, then so be it. It's still the right thing, and it's still the way I will always roll. In terms of disadvantages, there are certainly new paths to be learned And I think it's really important to surround yourself with experts in how to navigate and negotiate some of these um, dark hallways here. You definitely have to know how to play the game a bit. And I will be relying on folks who have had their boots on the ground in Washington to help me get what I think needs to be done and what the people that I represent tells me needs to be done in an effective way in Washington, D.C. So I've always relied on experts when I need an expert, and that's what I'll continue to do in Washington because I'm not going to have another. I spent 25 years in medicine, and I'm not going to. I don't have another 25 years to learn how to walk those paths without a lot of support. So I'll be expecting and needing that.
That is really awesome, and you actually brought up a great point. Now it seems like to get in, it's just career politicians, whereas back in the day, in our country's infancy, you had inventors, you had diplomats, scientists, inventors, technologists, philosophers, and you had more people with world experience and knowledge. And so, yeah, it'd be really nice to have I would say more impressive representatives than maybe we do right now. And so, yeah, thank you. And then I'll hand it over to Jenny.
All right, Jill. To our listeners, Jill was mentioning about AOC, which I'm not sure if many of you are familiar about politics, but AOC is a part of what they call the Squad, which is a group of 6 Democratic members of the United States House of Representatives. It initially composed of 4 women, which consists of AOC, and that's her short name. Everybody knows her, but her name is Alexandria Ocasio Cortez. I think I kind of butcher that name, and she's from New York. And then there's Ihan Omar of Minnesota, uh, Ayanna Presley of Massachusetts, and Rashida Tlaib of Michigan. I think I butchered that name too. So if you want to learn a little bit more about AOC, just go ahead and Google AOC and then the Squad. You will learn more about AOC. And also, Jill mentioned about Elizabeth Warren, which she's actually one of my favorites too. And I would love to sit down with her one day because I think she needs someone like, oh, I'm just going to say it, someone like me to talk to her about Bitcoin and cryptocurrency, to get the facts before she dives in and start, writing the laws and the bills and stuff like that. I know she has people talking to her about it, but I would love to meet her one day. But back to Jill, I have 2 questions for you. Well, first of all, thank you again for being with us today, and it's grateful to have you here. I might have a couple medical questions later on, in this live, but here's my first out of 2 questions. What are you most looking forward to learning through this process of running for office, as well as when you become elected? And what are some interesting things you have learned so far? That's my first question with a couple parts.
So I think the thing that I'm most looking forward to is discovering ways to unite our very divided um, American public. I do not believe that the very conspicuous divided nature of our politics is reflective of the actual differences and the people that make up this country. And I've seen this on the road, on my campaign trail, when I talk to folks. I ask them not about the hot issues that I know are going to put them on the left or the right, but I ask them what their greatest concerns are. What are they fighting with on a daily basis? What keeps them up at night? And the answer to those questions are very often bipartisan issues that we can come together on. And I think in identifying those issues, we can bridge our American public, and I hope shift things to a more progressive agenda. So, for example, several weeks ago, I went on a trip into even more rural area of Wisconsin and visited with a set of different types of farmers. So a crop farmer, a dairy farmer, and then a grain elevator where they produce the grain for the cows. And the side of their barn had a sign bigger, than three of me, which said Pence Trump on it. And they were very grumpy when I first arrived until we pulled out the cookies in the subway and, all sat down and started chatting. And by the end of the conversation, I was able to at least identify something that I could fight for them for once I get to Washington, D.C. And one of those things was simply regulating crop prices over the day. So when they have their crop prices changed 3 times a day, and actually this will be familiar to some of you because of the fluctuation of cryptocurrency. And so at maybe they're 5 a.m., let's say they know they've got to sell that day. They've got to offload this stuff. They don't have any more room to store it. They've got more coming in. It's down 5 cents per bushel, and they decide to buy. So they buy, yeah, I mean, they decide to sell. So they sell all of their produce down 5 cents per bushel. And then at noon, they see it has popped up by 36 cents and they've lost thousands of dollars. And this is something that I think could be addressed and regulated and kind of normalized over the course of a day or a week so that the farmers are not playing a game of chance with their crop. So I really do believe that one of the lessons that I'm going to learn during this campaign, and one of the lessons that I'm going to learn and build upon as a senator, is how to bring people together. And I think once you build that base, you're in a better position to talk about the tough issues, like LGBTQ plus rights and like racial injustice and environmental injustice and all of the things that are really driving my decision to take this stand. Those things can be accomplished once you build those bridges. But until we can build those bridges, we really don't have a place to start those kind of conversations. So you have to kind of connect with people. And I'm really looking forward to that.
Those are great questions. I'm going to add a quick follow up just in case some of our listeners, as you know, you mentioned a little bit about cryptocurrency and your responses there, and crop in Wisconsin. I'm going to gear towards a little bit towards cryptocurrency, but you don't have to answer about cryptocurrency. It's more of the political side of cryptocurrency. And here's that follow up question. Because as you know, a lot of our listeners or those who's going to be listening to us or those who follow Aaron, myself, and Tim, Dogecoin Militia, are within the Dogecoin community, which is still, I believe, is the biggest, if not most well known crypto community within the crypto space. So there's a lot of newbies within the Doge community, and a lot of them they don't know about politics, right? And so here we are. And so if say one of them were to come and ask you, well, Jill, within the crypto space, there's a lot of talks about regulations. They're going to be regulating it, this and that, the Bitcoin, and all of these other kind of cryptocurrency. Could you share with our listener a little bit more in terms of what would it take for, say, a law or a bill that is being written say from yourself once you get elected and you become a senator, and they talk about cryptocurrency, and then you need to write a bill and you need to make that pass. Can you give us a little bit pathway of how that is done, like who writes it and how does it get to the House and how does it get voted, and then how does it get to Biden's desk so that it be signed, etc., in terms of that path?
Sure. So, um, so things start in the House of Representatives, um, and and usually the ideas for bills are generated either through connections that voters have with their congressman. So, for example, you'll often see, hey, if you don't, if you have bad health care or you want Medicaid expansion or you are paying too much education tax, then contact your representative. So, those types of contacts and conversations will often initiate discussions regarding a bill. The bill is then researched and written by a group identified by the representative who wants to sponsor the bill. So, for example, Tammy Baldwin is involved in a bill in Wisconsin that is focused on getting the word milk off of non-dairy products. So, for example, oat milk. So she's a senator and she's working with the House of Representatives and a House of Representative from Wisconsin, a representative from Wisconsin on that bill. They design the bill, and then while they're working on building and writing that bill, they share it with other people in the House who might be interested in co-sponsoring it. And the more co-sponsors they gain, the more likely the bill is to be picked up and carried through the House of Representatives. So lots of bills get written and a lot of them go nowhere. They just stick on somebody's desk or in someone's email and just don't go anywhere. And you can look online and see, like, you can look up a certain bill and see what the chance is that it's actually going to get passed. And sometimes it's like 2%. So that's hundreds of hours of somebody's invested or a group of people's invested time to write the bill. And then it just doesn't go anywhere. So it's really up to your representative to identify the type of policy and collect the type of information to support the policy. And then also to do the legwork of reaching out to other politicians and other representatives who see value in it. And that is, I think, where being effective as a leader comes in. So once a bill is written and is picked up by some sponsors, and it gains enough traction to be brought to the desk of the House Speaker. So in this case, currently, that person is Nancy Pelosi. Then she would consider bringing it to the floor and they would discuss the bill and then vote on it. If it passes the House with a majority, then it goes on to the Senate. And then in the Senate, it has to be discussed and voted on again. And oftentimes it requires more than 50% of the votes in the Senate to be passed. Then it's 60 out of 100 people often need to pass it under many circumstances. There are exceptions to that. And that's where all of the talk of the filibuster is. And that's where things get hung up. So the problem is that there's a relatively low output. If you look at all of the bills that are written and fought for, the number of bills that are actually passed is quite a lot less. So your representative can be doing a lot of really good work for you and trying their best. But if it's not, priority type of legislation, and we don't get enough other representatives jumping on the bill, then it can be stuck in legislation, stuck in the House or stuck in the Senate.
Now, there's a quick question in my DM from a Bitcoiner, which is following your responses right there. Is he just asking where would the lobbyists be in that process that you just explained? I mean, for lobbyists, where do they come in?
Great question. So the lobbyists are everywhere. There are way more lobbyists than there are representatives in Washington, and they are doing the same thing that voters and constituents, the people who make up the citizens of this country, they're doing the same thing that you can be doing as a voter, and they are pushing their own agenda. So the problem that we have in this country is that lobbyists are paid by whoever whose ever agenda they're looking out for. So, for example, in healthcare, there are groups of lobbyists that are fighting for the I don't want to say the rights, really, the agenda of, for example, big farm, or for the agenda of hospitals, or for, hopefully the agenda of human rights activists or Planned Parenthood. And those lobbyists are actively engaging with elected officials to try to influence the writing of bills in their favor. And that can be something that you agree or disagree with. There are lobbyists working in every which direction, and it's up to the people who are writing the bill to actually come to a final decision on what bill they want to put forth. Some lobbyists will actually, try to involve themselves in the writing of the bill. That's what they do. They present options for the writing of the bill to influence the outcome of legislation.
Great, thank you so much. Now to my second question. Could you explain your background in medicine? What inspired you to choose this field?
So why did I choose medicine?
Yeah, both
Okay.
medicine and then now diving into politics.
So um, I'm doing politics for the same reason that I chose medicine. So that makes it easier. Um, so when I was almost 2, my dad, who was 29, um, died at home. My sister was 3 and my mom was 25. And he died because when he was in 3rd grade in the 50s, he had strep throat, just like I'm sure everybody on this call has had at one point or another, and um, and didn't have access to health care and wasn't treated. And sometimes when that happens, people develop something called rheumatic fever and then rheumatic heart disease. And my dad was one of the unlucky people who had that complication. So he was sick his whole life, um, and and sadly died very young. And he was, I mean, of course, I'm proud of my dad. He was a cool guy. He had his doctorate, his PhD from Duke University when he was 25 years old in economics, and he studied apartheid in South Africa. So he was a good guy. He had a great life plan, and he didn't get very far with it. And the reason he didn't get very far with it is because he didn't have good access to health care. And on the other hand, my mother got remarried about 4 years later and had my brother, or maybe 7 years later, and had my brother. And my brother was born just a little over halfway through pregnancy at about 28 weeks or 27 weeks. And he weighed 2 pounds. And this was back in 1979 when most babies who were born under those circumstances did not live. But we had awesome health care for him, and he's done very well. He lives with disabilities, and I'm his guardian with my sister, and he actually works on this campaign. He has helped us with all sorts of things like getting interns and finding our headquarters and that kind of thing. So, very early in life, I was aware of the difference between what happens when you have access to opportunity and what happens when you don't, and whether those opportunities are healthcare or education or safety, or transportation or broadband internet for that matter. No matter what those opportunities are, if you don't have access to them, your life is just limited, and your ability to be your best self and fulfill your dreams is. And so that's why I went into medicine, because I wanted to minimize that and to, work hard for people's health. And that's why I've done so much work with global health. And that's why I live in rural Wisconsin, serving, people who have access limitations. And I love my job, but recently, and particularly over the last 5 or 6 years, it's become increasingly clear that people do not have the opportunities that they should have and that they deserve. This is the richest country in the world, and we have folks who have food insecurity. We have issues in our country that are so beyond um, comprehension. How did we get to a place where police brutality is the way it is, where racism is turning up everywhere in this country, where LGBTQ plus rights are growing and being attacked at the same time, where reproductive justice, which was Roe v. Wade and all of the rights that protect women's right to choose, those decisions were made 50 years ago when I was a little kid. And here we are still worrying about and trying to protect these things. And I just realized that the same passion that drives me to go to, 13 years of school after high school and to work 50 to 80 hours a week while raising 6 children, the same energy that I brought to that fight is the type of energy and dedication and commitment that we need to represent the people of the United States and to make sure that opportunity is available to everyone.
Great. Tim?
Yeah, no, I think it was kind of a twofer because you answered my next question, which is going to expedite me onto my next question. Uh, Doc, obviously, I'm also in medicine, right? So this question is one that hits home for me as well. If you could describe the biggest discrepancy that we have currently with health insurance, currently as it functions, and the weaknesses that you've seen both in medicine and as a citizen, those hurdles that we need to solve.
So the biggest problem with our healthcare system, is that what you're saying?
Yes.
Oh boy, just one.
Yeah, I know. So I'm like, this is a very short question, but it's very, very loaded.
um Okay, well, I think the biggest problem that I have with our healthcare system is that it perpetuates and even grows um, wealth and racial inequity. So, currently, if you're wealthy, you live longer. You have everything is better for you. You have a better job. You have better health care. Your kids have better health care. Your kids get a better education because they can be in a better zip code and have a better school. And everything is set up to make sure that those who are wealthy stay wealthy and get wealthier, and those who are not wealthy, and whether those are socioeconomic inequities or racial oppression and suppression, which is very, in my opinion, intentional. No matter what, our healthcare system is doing a lot to perpetuate that. So um, currently, our healthcare system is not made for everyone, and that is my big problem. I think that by implementing a healthcare system that covers everyone, and I'm specifically speaking of a single payer Medicare for all model, which I can explain, that will promise that no matter where you're born, no matter the status of your parents, their education, their employment, you will have health care. And I think that's a start. I think that's not a complete solution, but it's a start to make sure that no kid is going to get strep throat and die when they're 29, and that no teenager. You have two teens, and both of them are suffering from opioid addiction. One of them gets treated, and the other doesn't. This is the kind of, I just can't stomach that. That's just so, it's so wrong and unnecessary. So that is my biggest problem with healthcare in this country. And I'll just for those who may not be familiar with what Medicare for all single payer means, I'll define what it means to me, because I've heard other people use Medicare, I think can be a confusing thing. So what I'm talking about is that every single person who lives in the United States, and notice I didn't say citizen, because we have, DACA recipients and we have undocumented immigrants, but every single person who lives in the United States receives comprehensive, high quality, accessible health care. And I mean preventative health care, emergency health care, I mean addiction medicine care, end of life care, vision, dental, hearing, psychiatric care, complete healthcare. We need to stop dividing our bodies up and pretending that our eyes and our ears and our mouths are not connected to our mental health and not connected to whatever I mean, your toes, for goodness sake, you need special healthcare to get almost anything done. It seems that it's all been separated out. So all of that needs to be covered under healthcare. And single payer means that we all get the same health care. And when we all get the same health care, then the people who are advocating for themselves and they're wealthy and they can push and advocate for themselves, they'll be advocating for everyone. And there won't be any undermining of the strength of our healthcare system, as I believe happens if we don't have a single payer system. I've seen it in other countries. The private health system undermines the integrity and strength and services to the public health system. So that's what I am fighting for. And I'll just add that I'm very concerned with debt. Leaving behind 6 children someday, and hopefully some grandchildren someday. I'm very concerned with our national debt. Medicare for all, single payer, will save our country $6 trillion over the next decade. Medicare for all with a public option or a private option, that will not. And it will not cover everyone. So we can cover everyone that lives in this country with complete, comprehensive, humane, dignified service healthcare coverage and save $6 trillion over a decade.
Now, Jill, I have a quick question to follow what you've just shared there. I know some of our listeners are probably fans of Bernie Sanders. Now, is it accurate for me to say that Bernie Sanders was behind the Affordable Care Act, and then there's the Obamacare, and then you just clearly explain about the Medicare for all. So there's like three that I've just mentioned. Are they all the same? Have they combined? And they're all from the Democrats. You feel free to let me know if I'm wrong. I believe I'm right. Are all three of them now or under one umbrella and it's called Medicare for all, or it's still kind of like different plans for different people?
So this is confusing. So first of all, Bernie Sanders is sort of the father of Medicare for all. So he and I see eye to eye on this. And secondly, Obamacare and the Affordable Care Act are two names for the same thing. And basically what the Affordable Care Act does is it incentivizes our population to purchase health insurance from an open market. And then it also regulates the type of insurance that is provided. So, so basically, there will still be a number of people who do not purchase the healthcare insurance that is encouraged by the Affordable Care Act, also known as Obamacare. When it was first implemented, there was a fine, so everybody basically was forced to buy it or pay a fine. But that was deemed unconstitutional in 2017, so that's no longer the case. If you don't purchase health insurance, then you do not have health insurance. Also, Medicaid and Medicare are part of those, or sort of part and parcel of those systems. So the Affordable Care Act takes into consideration eligibility for Medicare and Medicaid. Even with the Affordable Care Act in place, there are people who have no insurance. 5 to 9% of children have no health insurance, even with the Affordable Care Act and with Medicaid. And Medicaid is a state-based thing, so it's not a federal thing. Some states don't do very much of it, and other states do a lot of it. So it's very, very confusing. And that is what I love about Medicare for all single payer. And that is, it's not confusing. Everybody's eligible. Everybody gets comprehensive health care, period.
That is awesome.
I have a
See, we're learning so much. Tim, go ahead.
Yeah, no, I was just gonna say, obviously because you have both side knowledge, right? So obviously you're a doctor, so you understand the business side of this. In California, there's always this back and forth of like, well, if I'm a doctor and I know that there's only so much money in the pot, then I'm just not going to accept Medicare, and I'm just going to make my patients be cash pay. So that's been a big talking point, which has kind of spooked a lot of people into like buying into the Medicare for all, because they obviously have a fear of losing their primary care doctor. I know the answer to my question, but I wanted to kind of ping pong it over to you, because I think a lot of people again are spooked and saying, well, I don't want to lose my doctor, so if it's a Medicare for all, I don't want to lose my doctor, so I want to hang on to what I got, right? So
So
I guess my question. Go ahead. I think you kind of understand where I was going with that.
I'll ask you a question. So are
Yeah.
you saying that people don't necessarily, they're worried about Medicare for all because they don't want to change doctors?
Correct.
Yeah. So so basically there will be very few doctors who do not accept Medicare for all, because every hospital, and I mean, there will be no insurance. So if I get my appendix removed, it could cost $30,000, right, for a surgery and a visit to the ER and a CT scan and all of this. It could cost all of that money. In order to get any kind of care done, you're going to have to go through a hospital, and every single hospital in the country will be, the insurance company will be Medicare for all. The insurance company will be the government. So, for example, all of the patients that come to see me for their mammogram and say, "Oh no, I want Dr. Battino to read my mammogram this year," I don't know. I won't care anything about them. I just know that I am under a contract with my hospital to read this, and this is how many hours I work, and this is, my job now, and that's how it works. I get paid based on my agreement with the hospital and the hospital's agreement with the government. So basically, for the most part, there should be no change. There's no in network or out of network. Every single doctor in the country will be working for, working for the government, or working for their hospital who's working for the government, is how it will work. If a doctor wanted to take only out of pocket pay, they would be in a conundrum, because I suppose you could build extremely wealthy hospitals and that sort of thing, but I don't think that is a viable solution, and it's not one that's reflected in other countries where this model is used. So the chance of patients having to change their doctor is pretty low, and the outcome of having care for everyone is exactly what we're going for. I hope that answers your question, and feel free to contribute,
Sure.
given your experience.
Yeah. No. One of the biggest ones that comes to mind is those that are very comfortable with like a Kaiser. They are obviously an HMO. They obviously function kind of like that, like a hospital setting, where they have the pharmacies on site, they have the specialists on site. If there's an on-site surgeon for basically everything. Do you see a Medicare for all kind of changing, something like a Kaiser, which is obviously a massive, massive company, basically having them to change how they function, how they operate to accommodate such needs?
I don't think that. I mean, I don't think that systems like Kaiser have much change to make because they're already remarkably efficient and well organized. So, you know, systems like Kaiser Permanente are really models for the way that we should be building healthcare systems nationally. To reduce redundancy, reduce cost, be able to negotiate for more affordable or completely affordable, I guess is the best way to put that, medicines and equipment, all of it. That's something that Kaiser can do because of the size of their corporation, and that's what our government will be able to do as well. So I think that people who are experiencing systems like Kaiser are probably not going to notice much of a change. It'll be people who are experiencing systems like I work in, where they have one insurance company that will let them go to these 10 doctors and this particular hospital and this particular pharmacy and use these particular drugs. Those people will be seeing an improvement, I expect.
Nice. Yeah, that's exactly, like, I've struggled very, very mightily to explain that because it's like a natural fear of losing something that I've been so comfortable with, right? So I do get a lot of the older population that they get rattled. Like I said, they get rattled in just the thought of, wait, I don't, can I continue to see my doctor? And then, those that don't know will say, I don't know, I'll find out for you. And it's like, just saying those words alone to someone that's, in their 70s, 80s, or 90s is like, holy crap, I don't know if I could get comfortable with this because I don't know. I don't know either, right? So um, it kind of leads me to the second part of this question, and then obviously I'll hand it over to Aaron. If let's say you have a offsite private practice facility that's more for like diagnostics, and they're not affiliated or contracted with a hospital, do you see any changes or effects to them for a Medicare for all? Obviously, technically you're supposed to be in Medicare, and the patient can opt out, or they have to basically remove themselves from being willing to use their Medicare coverage. Do you see private practices that are not contracted being impacted by a Medicare for all?
Yes, I think those practices will be affected. So, currently a lot of, in particular, like diagnostic imaging centers or little surgical centers that are popped up, those I feel are sort of the result of our current system where, um, where it's necessary to make sure that the hospitals or the groups that own those collect as much profit as possible from private insured people so that they can kind of subsidize care for those who have less insurance or who have Medicare, which would be a lesser reimbursement. So I think that will change, and I think that if you look across the spectrum on how this impacts doctors and their income, I believe that if you are making an astronomical amount of money, so within your specialty, if you're at the 90th percentile, then you're probably going to come a little more towards the center. And certainly if you're at the 20th percentile, you're going to come up towards the center. And that's probably how it should be, because a lot of that is based on geography and sort of cherry picking of patients and picking those that can pay the most. So really, it's equitable to begin to remove some of that redundancy, those extra imaging centers and those extra CT scanners that are built in the fancy part of town will no longer be necessary because all of the budgeting will be coming from the government, and there'll be a lot of cost cutting, and that will include removing, wasteful spending and having redundancy of equipment and that sort of thing.
Yeah, no, you totally hammered home again there are a lot, and you know this just as well as I do, there are a lot of very unnecessary procedures that are done in private practice to help pay for a second home, mortgages. Like, it just goes on and on and on. I mean, you can open article after article after article of, doctors being popped because of unnecessary this, that, and the other thing. And again, this is only going to tie into my question that's actually later, um, in regards to the opiate crisis. So I'm going to hand the next question over to Aaron. But yeah, no, I appreciate your feedback on that. And I think, piggybacking on what you just said, I think it will absolutely clean up the healthcare industry from malicious or self-fulfillment in terms of procedures that are not warranted, which is very scary, and it's very sad that it even exists, but unfortunately it does.
Mm-hmm.
So
Okay. So before I ask my question, I just want to give a huge shout out to everyone in the room listening. We put on these spaces for you guys. And so, I see a lot of familiar faces, and just know that we appreciate seeing you here because, again, we just want to educate and hopefully inspire. So, my question was going to be, how has the pandemic affected healthcare? And has that event, I guess it's still going on, brought any good changes to our system? And maybe what are some of the flaws that COVID revealed?
So I think it's easier to start with the flaws. The number one flaw has been our ability to communicate with the public accurately about what is necessary to take the steps to protect ourselves and our neighbors and our families from infectious disease. And then another, almost equally important flaw was our lack of preparedness. And I think that goes hand in hand really with the communication. Just not having the stockpile of ventilators and the necessary PPE, protective personal equipment to protect our healthcare workers and our population, not having a communication system in place to make people feel confident that they were getting accurate, up-to-date information. So those are some of the flaws that it brought forth. In terms of good things, I think a lot of sort of incidental good things came of this, from recognizing the ability of our working population to work remotely successfully and effectively, which has the potential to be a positive environmental influencer, not requiring enormous um, buildings with all of the infrastructure and air conditioning and lighting and all of that electrical drain and power um, that is contributing to our environmental crisis. So I think that's one of the things that became clear. Also, another thing that became clear was educationally that we can weather the difficulties that we may face with future challenges, whether they are here in Wisconsin, snow days, and finding out that, oh, wow, we don't have to cancel school. We can actually do it online. And that we can reach people with other educational opportunities online. Online education of course, has lots of difficulties, but it was one of the things that became clear to me. And particularly in my circumstance, working globally, we were able to provide, interpretations of CT scans that were obtained in the jungle in Guyana, here in Wausau, Wisconsin, or in Seattle or wherever, because of that infrastructure that was necessary to ride out the pandemic. And I think another good thing is that it really brought about a focus on the importance of science and medicine and research and policy that's based in those within our government, and unfortunately brought an almost equal pushback from those who don't want to hear the bad news, or perhaps have a different agenda of just maintaining the status quo and not the Trumpians who are trying to divide our country. Those folks, I think, unfortunately, also gained a platform. But I do believe that getting science and medicine and research into policy in a very intentional way as part of the outcome of the pandemic.
Aaron, if I may ask Jill a quick question to follow up. Jill, in regards to the COVID, I know you're in Wisconsin, and I recently traveled to a few states and a few major cities, and the simple of wearing a mask is different from city to city. Now, in terms of, we just celebrated July 4th, which was when President Biden's just barely sworn in. His original goal was 70% of American adults were to receive at least one dose of COVID by July 4th. Obviously, he did not meet that. And I believe he was a few million shots away from that goal. What are your thoughts? I know you're in Wisconsin. I'm in California. In terms of wearing a mask, do you believe that? Should we still be wearing a mask? What are your thoughts about that?
So I think it really depends on your vaccination status, and also I think we have to be educating people about the fact that what is true, this week may not be true next week. So, for example, right now, the CDC is saying that if you're outside and basically if you're vaccinated, you can sort of go back to normal. And yet we have brewing across our globe the Delta variant and other variants that are growing out of unvaccinated populations that carry tremendous threat. Some variants are not going to matter. We won't even know they exist. And others may be potentially more contagious or more deadly. So we will have to keep an ear tuned in as to what is a good idea and what is unnecessary. And I think what's difficult for many people who maybe don't have a background in medicine or science to understand is that this is not a static thing. This is going to be changing, and we have to continue to conduct scientific surveillance and kind of keep our feelers out for what's going on in our communities and how much Delta variant or what other variant we're seeing and how that particular strain of coronavirus, or even if we're talking about a different type of infectious disease, how that is affecting individuals who have or have not been vaccinated. So, for me right now in Wisconsin, I am, of course, I'm vaccinated with both shots and have been for some time now, and I don't wear a mask except for at work. And the reason I wear one at work is because there's still a small risk of transmitting, like physically transmitting the virus, even if you are not sick. And there's also, just because you're vaccinated, it doesn't mean that you are, completely unable to have any sort of infection. It just means that you are prepared to mount a strong immune reaction and protect your body from a serious infection. So I do wear my mask when I'm in situations where I'm around somebody who's vulnerable to potentially either they are not vaccinated or they're immunosuppressed or whatever. I wear my mask, but otherwise, I generally don't wear it. I think if I was, one of the difficulties here in Wisconsin is, as we know, about only half of the people around us are vaccinated. So, and nobody's wearing masks. So if you're indoors, and you're looking around and nobody's wearing a mask, it's not because everybody in the room is vaccinated. So that's a time when you may want to consider putting on a mask to protect yourself, or perhaps not to be in large crowded spaces indoors. So I think we have to, continue to be vigilant about the situation and understand that it's not, a black and white situation, and that it's going to be changing over time. And to trust the experts, even when their opinions change. Their opinions change based on research and science, not because because they didn't understand the first time what was going on, but because they were attempting to navigate and manage it in the most successful public health policy way.
One tiny more follow-up. Sorry, Aaron. This is intriguing to me. So just wanted to ask, since the doctor is in the house, I might as well just get her thoughts. And this is personal for me, Jill, is I usually call myself a chicken because I have so much work to do and I don't like to get sick, being in the hospital, blah, blah, blah. So I've read a lot and I've heard a lot that even if you've already had the shots, and I did, I had two Moderna shots. Um, and people's been telling me that it's rare, but I can still catch COVID, correct? And that's why, I mean, it doesn't matter where I go, I always wear a mask. So because there's still this fear in me that I just don't want to get sick. So
Hmm.
is it true that even if you've had the COVID shot, you could still get it and you could still be extremely sick and being in the hospital, as if you never had the shot? Can you share a little bit more about that?
So it's very rare to require. It really doesn't happen with statistical significance to require hospitalization. But it certainly is true that you can get sick. You certainly can get coronavirus after you've had both vaccinations. So it's not unreasonable at all to continue to wear your mask if that makes you comfortable.
Gotcha. Thank you so much. Thanks, Aaron. Back to you.
Yeah, so I want to thank you for. We got a lot of information over the past few questions, and so you probably already answered this, but just to put it in sort of simple terms, what are some of the most important challenges in healthcare that you want to combat by being in office, and by that I mean by having to work within the system.
Okay, yeah. So I think probably number one would be making sure that everybody has accessibility, which is not easy because you know there are locations are an issue, and you just need to make sure that the folks who are being cared for have healthcare that they can get to. So transportation and social issues, all of those sorts of things need to be addressed. Number two would be making sure that we are very inclusive with the design of healthcare, and that we do smart, inclusive, intentional things like building out our healthcare system to specifically accommodate marginalized or historically marginalized people, including our Black and Brown people, our LGBTQ plus people, and being certain that healthcare accessibility is not ignoring any population, including immigrant populations and people who may not have citizenship. So those are some of the areas that I think are most essential and that I would address urgently.
Thank you.
All right, back to me. I actually have a question from one of our listeners. Michael Zahorsky, you can say hi. This is your question. Just use the emoji on the bottom right there, and then just say hi, Michael. Anyway, all right. So here's the question, Joe. What what is your position on more crypto related businesses coming to Wisconsin, specifically to Milwaukee and Madison? And will you encourage public school systems to finally start educating students on financial literacy? Those are great questions. Thanks, Michael. Go ahead, Joe.
Okay, so the second one is in my head here and very easy to answer. Yeah, financial literacy is a terrible problem in our educational system, and I actually believe that in general, our entire educational system really needs to be revamped to accommodate the needs of students in this day and age, and financial literacy is part of that. So absolutely on that. And I'll just add in there that in reimagining how we teach our students, I also believe that we need to reimagine how we fund our educational systems, because one of the things that concerns me most is that about 45% of funds for a school come from the district. And if the district is a district where students live in poverty, then there is no elevation of property tax, which tends to be the way that that money is raised, that will reach the level to accommodate the needs of those students. So we need to be smarter about what it comes down to is we need to be smarter about how we fund our public schools and what they're teaching them. And certainly financial responsibility and finance management is part of that. In terms of bringing crypto to Wisconsin and crypto-based businesses, so here's where I am with cryptocurrency. Over the last week or so, I've been researching, and I've actually met with an economist to learn about cryptocurrency and what it brings to the table, and where it came from, and how it works, and what the pros and cons are. And what I would say is that, like anything else that you'll hear out of my mouth, we have to be very intentional and smart to be sure that we are putting, human rights and protecting our rights first. And as long as we're doing that, then I'm open to any conversation. So, in other words, there's a lot of talk as soon as you start as a person who's not got a history with cryptocurrency or with with that sort of, I'm not literate in that sense, and I haven't been. As soon as you start looking into it, there's talk about illegal activity and about volatility and about the risk of perhaps people who don't have the educational background to understand the risks. Well, what if somebody takes their life savings and puts it into a type of cryptocurrency that is highly volatile, and they lose their savings because of their own ignorance and not understanding how it works. I think we need to be very intentional and cautious and just protective. I thought it was super cool. I think the chiropractic group accepts cryptocurrency. I thought that was really a neat idea. I think there is an immense potential and an immense potential future for cryptocurrency. And we just need to be very thoughtful about how we approach it, and try to glean its pros as much as we can, and be careful about its cons, including environmental impact. So those are sort of my general feelings there.
And certainly, I'm totally with you, Jill, on that aspect. Although, I believe in regulations. I do believe cryptocurrency should have more regulations to protect the public, but also to kind of be fair. I came from Wall Street, and there's a lot of frauds on that side too. There's penny stocks. There's a lot of speculations on. I'm sure you've heard of pink sheets. Those
Mhm.
are even less than penny stocks, and they're extremely risky. They're literally gambling, which I consider cryptocurrency as a form of gambling itself. But yeah, I mean, certainly you're right. Cryptocurrency, there isn't much rules and regulations these days, and I do believe we should have some, but there is definitely a fine line between totally regulating the space and literally kill innovation versus just enough so that consumers and the public is well aware. And especially a lot of these exchanges are doing, I would admit to that, a lot of fraud, scams, rug pulls, and stuff like that. That's where I believe we do need a lot of regulations to make sure the exchanges are placed in a very high value, just like if you were to open a stock brokerage account with Goldman Sachs or even TD Waterhouse or Charles Schwab, you know that you're safe. You're not going to be rug pull when you wake up in the morning. But thank you so much for that response. For Michael, which is a listener. Now here is my question. Okay, my question is, what changes would you make right now if you had the absolute power, not needing any support or votes?
Um, well, I think that right now the biggest threat to our democracy is voter suppression. So, right now, today, I think that the change that I would make is that every single citizen is automatically registered to vote when they're 18, and that it's a holiday, and that we get every person out that we can possibly get out to vote. Because while it's my opinion that Medicare for all is the best solution, and that immigration reform is essential, and that climate change solutions are 20 years overdue, I think that those decisions have to be made by and supported by the American people. And if we cannot vote, then none of those other things matter. So I would change. I would change voting right now today.
Great, thank you. My second question is, as a doctor, as a physician, when it comes to healthcare, what do you feel the general population maybe doesn't understand and should understand as it pertains to the government's involvement to ensure coverage for everyone? For example, how much money does it cost, or how the fund gets replenished as the population increases in both newborns and immigration, etc., etc.?
Okay, so that's complicated, and I'll give it a shot. So basically, right now, um, our healthcare system costs about $3.6 trillion a year. That's how much our we spend in healthcare a year. About 3.6. About 2/3 of that is for things that are not going to change no matter what. So that would be the VA, Medicare, um, and our military care, some of our tribal nations care. This type of thing is not going to change. And then about 1/3 of that would change with Medicare for all. The money for to fund these things comes from taxpayers. So it comes from our revenue that we collect, whether we're talking about paying taxes, whether we're talking about China paying taxes to the United States for imports or exports or tariffs, or all of those things. That's income that our government generates, and that's money that they spend towards healthcare. It also, of course, comes from your federal income tax, but it comes from all of the ways that our government collects funds. So when we increase our provisions of healthcare to our population, the way that that is paid for is by doing a couple of things. First of all, it would be by reducing the cost. So we have to do better with that. If we can make it a public health system where the government is the insurer and has the power to negotiate prices, then we can make it less expensive. We can make our pharmaceuticals, our medicines less expensive. We can make the equipment in the hospital less expensive. And there's room for all of that. And I can give an example. If we're buying an ultrasound machine, we might buy it from one company that wants to charge us $250,000 for it, and another company that says, well, since you're in this hospital system and your hospital system buys a whole bunch of them, then we'll just charge you 200. So you'll save 50,000 on each one. And those are the kinds of deals that our government can work out to decrease the cost and also improve the quality. So we can improve all all of that will basically reduce the cost of our healthcare a lot by about 0.6 trillion, so that our overall cost should be about 3 trillion instead of 3.6 trillion. And that's how we save $6 trillion over a decade, because we reduce the cost by 0.6 trillion. And that money comes from our existing population. If we are going to take care of immigrants, if our population is growing due to immigration, that can be a very good thing. We need to make sure that people have job opportunities and that they're paying taxes, which is why immigration reform is so important. One of the reasons is so important to our economy, not just to our humanity and to human dignity, but also as contributors to our economy. As we're rebuilding our country to address climate change, we're adding solar fields and wind turbines and upgrading our electrical infrastructure and replacing lead pipes and building better roads, all of those things, better airports and developing new technology and innovation. As we're doing that, we are going to need more workers. We don't have enough workers in our country right now to fill those needs, those jobs. And we're not just talking about technology, we're talking about teachers to teach the kids of the parents who are doing this work, and we're talking about educators and scientists to develop the new technology. So we need more people to fill those voids. And so we need immigrants, and we also need them economically because they will be working and they'll be paying taxes and contributing to the overall economy. So these things are all connected. Basically, the idea is that everybody gets a fair shake, and that you work to have your to feed your family, and you pay your taxes to have your infrastructure, which should include education, healthcare, and utilities and fair housing and all those sorts of things. So it's all connected, and it can all be fair and supported through proper taxation, and making sure, I'll throw in there, making sure that the very wealthy, the extremely wealthy in this country pay their fair share.
Yeah, and thank you so much, Jill, for that. And it's funny how you were talking about, paying our fair share of taxes. But, as I was mentioned, that I used to be on Wall Street, and I manage money for I call them the bazillionaires. And it's the bazillionaires who really don't pay taxes because they
Mm-hmm.
have great tax attorneys. Well, you know what I'm talking about. And then they would, funnel monies to the Panama, to different types of trusts so that they can hide from paying taxes. But definitely we're going to invite you back. So that's a different topic altogether. So I just wanted to share that. That's also an interesting topic. Is how do we get the richest, the wealthiest, the elites like Bezos, Trump, etc., to really pay their fair share, and not just the middle class who's making six figures, or like 60, 70,000 to $200,000 to $300,000. I got a number of friends who are engineers in San Francisco, while they're making $200,000 to $300,000, but they can barely afford $1 million home, for
Mm-hmm.
example. So yeah, but that's totally a different topic altogether. We would love to have you back again so we could share that topic next time. But gonna give the mic back.
We have an ongoing opiate epidemic that needs attention. How do we actually get control of the crisis, given that so many of these drugs come from across the border, both north and south? And if you want to touch on how it's also coming from doctors too.
So, so often I feel like education and prevention are tools that we're underutilizing. So, um, you know, the first, I mean, opioid addiction starts somewhere. Obviously, we have addictive personalities, and we have addictive tendencies as human beings. And I mean, all of us have that ability, but why does it start? And if you look at the research, very often it's because of a short course of opioid therapy for acute pain. And so I think that we need to educate our patients, but also our doctors very broadly about the proper utilization of analgesics, of pain medication, and particularly addictive pain medication. And I think that this is probably state regulated. I know that in the state of Wisconsin, I'm required every year, every 2 years. I don't know. It comes about so quickly to do several hours of medical education requiring um, the proper way to treat pain, and then the proper, dispensing and utilization of addictive narcotics. So giving short courses of the minimum required dose to affect the patient's pain, and making sure that you have short interval follow up with your patient, and good contact and good patient education and patient agreements that require actual conversations that are detailed so that your patient understands exactly what the expectations are. So I think a lot of it does start with prevention and education, both for the care provider who's writing the prescriptions and for the patient who understands going into it that there's an addictive potential for their situation, that we're choosing to expose them to that. I think alternative therapies are also really important, and that we need to work on developing alternative approaches to pain management, and that's becoming a popular thing nowadays, making sure that people have, for example, chiropractic and proper nutrition and sort of a comprehensive naturopathic kind of approach to taking care of our bodies and pain management. So I think that's a key part of it that shouldn't be ignored. In terms of where the medications are coming from, I mean, obviously we need to secure our borders and be sure that we're doing a good job of surveilling the types of imports, and limiting the illegal transfer of drugs into this country, and particularly making sure that we're doing due diligence. And I think immigration reform is part of that, and our border control is part of that. But I don't want to, you know, conflate immigration with a drug problem, because I don't think that's fair. I think that most of the people who are trying to come into this country are coming here to escape dire circumstances, and so I don't want to confuse the issue there. But my point is that I believe that the most important part is prevention and education, and then of course treatment, and making sure that people who do have addictions have complete and comprehensive support for their healing and their treatment. And that again goes back to Medicare for All and addiction as something that's covered, that's well covered and is available.
Having the ability to prescribe legally, for example, 3-day doses rather than 30 days, with 3 to 6 approved refills.
So, yeah, I mean, certainly, requiring physicians to follow a set of guidelines is really helpful. But it also it's difficult to impose strict laws and rules about how to advise and take care of patients, particularly, patients who have chronic pain, or perhaps are at end of life kind of situations where they're facing hospice or home care. So I think there do have to be guidelines. What I've seen utilized broadly and seems effective is creating guidelines that are available, and providing the proper education, and then sealing certain locations or providing incentives like center of excellence identification, and other mechanisms of rewarding physicians and facilities that meet the standards and truly go the extra mile to protect patients and treat patients for addiction.
Gotcha. I just want to do a quick mic check, see if Tim. Oh, I think he's still at one bar. I'll toss it over
Well,
to.
I'm here. I'm here. I got a little pocket.
Oh, here.
I got a little
Okay.
pocket.
Nice.
I don't know. Did you guys touch on? I literally missed like the last 20 minutes, which sucks for me, but thank God it's recorded, right?
Yeah.
Yep.
Did we touch on the question about the FDA?
No.
Nope, not yet. Go for it, Tim.
Jill, are you ready?
Yeah.
Hopefully I don't lose service. In terms of like what happened with COVID, obviously we saw the ability for the FDA to expedite vaccinations. Obviously, the circumstances were a lot different.
considering it was a world pandemic. Do you see flaws that were illuminated as a result of this in terms of possibly needing to restructure the FDA, considering there's still a lot of nasty diseases out there that have to go through multiple cases of clinical trials? One that's near and dear to my heart is ALS. Something that probably should have been eradicated a long time ago. And obviously, just like I do, how hard it is to not just be a part of a clinical trial, but be considered and then accepted. And then obviously you're either given placebo if it's double blind, all that fun stuff. So do you feel that there was anything illuminated during COVID in the ability for the FDA to expedite vaccinations nationwide, and the ability to help expedite vaccinations or cures for other diseases as well?
So I think this is a really interesting question. So our current system is obviously intended to promote technology and the development of cures for disease, whether we're talking about infectious disease or neurodegenerative diseases like ALS, or Alzheimer's for that matter. There's a new drug out for Alzheimer's recently. Um, and while doing that, we want to be certain that we're putting, that do no harm, which is the mantra of medicine, is put first. We don't want to take risks for our patients. At the same time, when a person has a serious disease, the risk benefit situation changes, right? Because not trying something is much more dangerous sometimes than trying something, and I think a person's willingness to take a risk is greater when their alternative is dim. So I believe that what came about was the recognition of what could be accomplished when we really put our minds to addressing an issue. And certainly, developing a vaccination is different than developing a cure for Alzheimer's or ALS or, many of the other diseases for breast cancer. It's different in that there is sort of a recipe for vaccinations, and there are certain, there are classes of vaccinations, and we sort of know how to build them. And a tremendously simple comparison that I sometimes make is the difference between making, maybe sugar cookies and chocolate chip cookies. Maybe you just leave out the chocolate chips, or instead of putting in chocolate chips, you put in butterscotch chips, and you end up with a different cookie. Well, our vaccines are sort of similar. They have certain types of things that we know have to be in them, and then we just swap out proteins and develop them that way. So it's a simplification, but it does show how much can be accomplished by humanity and by scientists when we come together and focus on something. And I think that is what really needs to be revamped. I think we need to find ways of focusing on the diseases that that have we're close, and we just aren't. It's a funding issue, or an attention issue, or sometimes just marketing, honestly, that gets a certain disease the type of dedication and science that it needs. So yeah, I do think that this is an opportunity to recognize that what we're capable of, and what we can change to make sure that therapies and test drugs are available to those who need them most, and are accessible to everyone. Again, this is an accessibility and opportunity issue. We need to make sure that these things are available. So I'll just go back to 2 points. Research is absolutely essential. Human beings and humankind is amazing, and when we come together, we can accomplish anything. And finally, we have to prioritize equality and accessibility for everyone when we think about these kinds of plans and policies and hopes for our future. We need to make it a humanity thing and not a business thing, not a capitalist thing. And that's not to say that we aren't a capitalist society and that we shouldn't be making money off of our investments and our creations, but to do it in a way that excludes other people is not acceptable. And I think that is another thing that came forth with the COVID, with the pandemic and the vaccination schemes, that we realize that accessibility is really important globally and not just nationally.
So actually, I wanted to touch on something that you were kind of talking about. It's sort of a bonus question that I was going to maybe ask you. It has to do with kind of like the future of technology, and how you maybe see that affecting both how the work is done and then the system. So, for example, when it comes to gene editing, gene sequencing, but also tied in with machine learning and neural networks, it's going to make some pretty drastic changes and improvements to how drugs are tested, created, especially when it comes to neural networks. So we'll be able to do it at a scale that is unprecedented, and also as well, from what my understanding is that sort of the way companies work. I personally see it as it's going to be a lot more larger companies rather than smaller ones that have really streamlined the process from how data is basically from how the client is able to access, and the doctor is able to access medical records and then upload and share all kinds of information. So again, whether that has to do with a certain disease or illness or condition, the landscape is going to be changing a lot. And so just curious if you have any thoughts or any interesting points or observations heading towards the future in that way.
Well, I think it's really exciting. There is talk within Google, and I know this through my international work, of developing open source data banks for AI development. And so that would kind of spark the initiative of people to share their information and make larger pools of data to allow the more rapid development of solutions to all sorts of problems, whether we're talking about, medications or education or infrastructure or whatever technology you might be talking about. So I think data sharing and open source sharing for data collection is a thing of the future, and it also has a mechanism of removing some of the inherent bias that exists in our scientific world, where we tend to get data, particularly in medicine, from wealthy people who have access to healthcare, and then it doesn't necessarily provide the same benefit to different populations and different demographics. So yeah, I think that's very exciting, and I've done some work in AI with breast cancer detection, and I'm looking forward to seeing that grow and answer a lot of our medical needs.
Yeah, and to touch on that, like I think one of the great benefits is that it also basically also part of the pandemic led to this. But again, these improvements will allow people to be able to work with not just local doctors, but to be able to find doctors basically anywhere. And then soon they should be able to upload and sort of match different types of information, whether it's genomic or RNA, et cetera. And again, be able to find the care that they really need anywhere, in the country or possibly in the world.
Yep, it's not too far away.
And so if Tim is still doing the robot thing, maybe Jenny can take it from here.
All right, I will.
Probably.
So I think see, he still is. He's a robot today. But I think we're about another maybe 12 to 13 minutes for a full 2 hours already. And I know we have so many great questions left for you, Jill. Though I believe for the sake of our listeners, we might need to invite you back for a second round. So within the next 10 to 15 minutes, we're going to take one more round. I'm going to ask my one question, and then let's see if Robot Tim is going to be back. He can ask his final question, and then Aaron can ask his final question. Then we're going to give you the mic, and if you have any last words for any of us, as this is again, everybody, it is being recorded. So if you miss any part of tonight's great live with Jill, We will have that recording up within the next day or two. So back to me, and here is my question. Okay, so my question is, what would you advise young minds out there who are considering pursuing medicine as a career? Now, here's a twist to that question. If they were to choose between medicine or being in politics, as in a politician, do you have a preference of either or in terms of which one is better or they're the same? I'll let you answer that, but that's my question.
Okay, so in terms of folks who are considering going into medicine, I would say do it. It is rewarding. It helps you appreciate every day of your life. I think it reminds you of what's important, and really keeps you grounded, and empathetic and kind, and honestly intrigued, because it's very interesting. So I would say absolutely do it. And we're going to need all kinds of healthcare people. So whether we're talking about physicians, or nurses, or pharmacists, or chiropractors, or allopathic people, whatever it is, we're going to need all kinds of people, because when we have Medicare for all, we're going to have a lot more patients, which would be a wonderful thing. In terms of picking between politics and medicine, I'll tell you a little story. So
I love story. Let's go.
So my oldest daughter, Ellie, she is a fourth year medical student in Chicago at Rush. And she's awesome. She's a really kind, sweet person, a big nerd like her parents. And she majored in economics in college, and she studied developmental economics. And I always wanted her to go into policy. And I always said you can affect change from policy, so much more efficiently. When you're a physician, you help one patient, each time you're interacting with one patient. So over the course of a lifetime, you affect fewer people. And when you're in policy, you can affect many more people. And I would say that those things are equally important, especially if you look at it from a personal point of view. If you're sick or you develop breast cancer, the relationship that you develop with your caretakers is so precious and so important, that it's irreplaceable, and it should be as close to perfect as possible. And I realize that there's a lot of dissatisfaction in doctor-patient relationships, but there are also those who really have a better experience because of the person that's taking care of them. And you can't put a value on that. It's just tremendously valuable and important. And yet, from a policy standpoint, you can, as I said, affect so many more people and make sure that it's more equitable and that nobody's being left behind. So I really couldn't choose between the two of them. I have to say that I'm very grateful for my own path, because I believe that as a physician who has had the opportunity and the honor to take care of patients in a very personal way, it makes my fight for a broader equity and for a broader solution that much more dear to me and more important to me, because I understand it in a very personal way, what it means when someone does or does not have what they need in healthcare, or in whatever it is that they need, whether we're talking about healthcare or immigration. My youngest son was naturalized, and was adopted. So so I understand what opportunity and what things mean from an individual perspective. Even me, as a child, I was adopted by my stepdad, not legally, by the way, but just he took me on and was my dad for my whole life, and that meant everything to me. And yet it's I think people sort of are kind of not giving credit to step parents for the work that they do. So I guess in some way what I'm saying is that I couldn't choose one over the other. I think they're both so very important, and I'm just personally grateful for my experience as a physician. I hope that it brings all of the compassion and hard work and nerdiness that will make me a great policymaker as well.
That was great. Thank you so much, Jill. How about the robot Tim? Are you back, Tim?
I'm
Tim? Oh no, you're not.
here.
Oh no, you're still a robot, Tim. I don't know where you're at. Are you at the airport or something?
He's
Oh
doing
my
his
god.
best Daft Punk impression. Um,
Yeah, that's hilarious. Oh my god. You know what?
so
We're gonna skip him, Aaron. So go ahead, Aaron.
yeah, so I've got a question that hopefully is helpful, but I want to start it off. This is what a thing that I love about this community is they're so awesome. So a shout out to Emily down there because she sent me a message and I'll just read it word for word basically. Hey guys, doing a quick search on Google and saw that if you search for Dr. Gillian Battino, her Google Knowledge panel, there'll be a little tab on the right side of the desktop screen when you search for this person, right? It's unclaimed. And so basically you can claim that and you'll be able to populate it with important stuff such as bio, social media profiles, and whatever other links or information so that people looking for you get the right information. So yeah, again, shout out to Emily for noticing that. And actually, I've never looked at that. I don't know what that is yet, but I'm going to find out what that is. But hopefully you get to it first so I don't put it all in the information for you.
Thank you.
And
Thank you,
so, yeah,
Emily.
yeah. And so my question was going to be, basically, thank you again for speaking to us. And I already got some DMs, like people learned a lot and I really appreciate it. I actually feel fortunate that I get to have the audio because I get to listen to it again tonight. So as I edit it, so because I've got a lot of stuff that I really want to make sure that I soak in well. So thank you again. And so, yeah, my question for you is, is there anything that we can do as a community to help you out? What are the best ways that we can help you out as a group or individually? Yeah, I'll leave it there because I might have a follow up question.
So I think, yes, I mean, the most attention that or the most, follows and retweets and mentions that I've seen on my account, which has, I think, about, I don't know, 17 something, maybe 1,800 followers, has been through your community. So, obviously you have a large platform. Lots of people who are involved in this have a lot of followers. And so if you follow me, that's awesome. That would be wonderful. It's Battino, the number 4 Senate. So that would be wonderful. And then, when something resonates with you, please retweet it. And, share my information out there, and get my name out there, because right now we're at the beginning of the race, but the big battle is name recognition. And of course, funding is always difficult. So, people don't want to give you money until they know who you are. So by retweeting and by, following and doing all the stuff that you guys do, that will help me with maintaining my viability in this race, which is basically done through fundraising. So that I would greatly appreciate. I guess the other thing is that don't be afraid if you see something, like, for example, Emily's suggestion just now. That's very helpful. I mean, certainly I just wrote it down, and I will be contacting my IT team and saying, hey, I don't know what this means. Please figure it out and do it for me. And so I really appreciate that kind of feedback. And I do, my DMs are open, and I will be, I do check them. And I have a social media team that helps me with that. So please communicate if you see something concerning, or I try very hard to be accessible, in other words, to the disabled community. I myself have moderate to severe bilateral hearing loss. And so I try hard to put alt text on everything, and be very cognizant of the way my tweets go out. and my hashtags and that sort of thing. So, please give me feedback as you see fit. I would appreciate it. And share and follow. And, if I ever figure out a way to make Bitcoin or Doge legal for the FEC, the Federal Elections Committee, I'll let you know. But right now, I think that would be wonderful kind of support that I need.
Yeah, for politicians, if you guys get together and somehow get, for the people to donate to your campaign, again, either Dogecoin or Bitcoin or Ethereum, because a lot of us, we hold those cryptocurrency, so that would be the next phase. But Aaron, Tim, is there any last minute for that? And, before we can wrap up here?
Oh, I wanted to throw one thing out. There are some other Dems who can use support. And Odessa Kelly in Nashville, she's got a really uphill battle and is an interesting lady. And might be, somebody that you guys would be interested in talking with. And then anyone who runs against Tom Tiffany. So Tom Tiffany is a Republican in my district in Wisconsin. He would go to the House of Representatives, and he is a terrible little minion of Trump's. So anyone who runs against him, please consider involving them in your community, because I think you guys have an effective platform that can really make a difference.
Yeah, so I wrote those names down, and I'm getting some, since Militia is having some trouble. He was definitely saying that you're always welcome to DM us, like those names or anyone that you can think of. We definitely want to build that network, and of course, like, we'll give a shout out. I think it's mutually beneficial, for one of them to hear that they got some support from you, and hopefully we can also, build some support for you from other people as well.
I truly appreciate that. It's interesting. I've finally, so Twitter was new for me until the last, I don't know, several months. And I finally appreciated that follows are a form of currency. So.
And I just got to read this real quick. You can hear me still, right?
Yep.
Okay, cool. So, Militia wanted me to say on behalf of him and myself as well, he is planning on staying extremely close with you. As much of what you said resonates with him, and he's all for helping in any way possible, except for when he has to talk like a robot.
Okay, great. All right. Well, I look forward to coming back and talking with you guys whenever that works out.
Yeah, we thank you so much, Jill, for today. We're definitely going to have you back. As and we're all here. If you needed us to, if there's any important tweets that you tweeted out and you needed us, sometimes we need help. Because we follow, like me, I follow a lot of people. So just tag us. Like if you just tag us, like you could do the tweet first, because I just saw your account. You just set up Twitter in February. So what you do is you could just do your tweet, the main point of your tweet, and then you reply to your own tweet, and then you tag like a couple people, and then from there we just pick it up. Because of your tag, we just retweet it, and then our page people would just retweet from our retweets, kind of like that. So
okay,
that would be helpful too, because sometimes we're not on Twitter all the time, and we would miss your tweet. So we're here to help you, and we're thankful that you're on today. Greatly appreciative. All of your responses were great, and we'll love to have you back again. And any politicians you recommend for us to have on our spaces, we're open to it, and we'll continue to keep in touch with you.
All right, wonderful. Thank you so much.
Well, thank you, everybody, for being here tonight. Have a good night, everybody. Take care.